Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
But it's an issue that this group actually anticipated, but the crisis was not dealt with. And so right now, people are having so many mental issues, but they also made a comment in the article in the Post about the fact that even the Black patients are not as stigmatized by mental health as they used to be. So uh, therefore, Blacks and Latino Hispanics are acutely having problems. So it's no surprise, but it's something that is difficult to deal with. We talked also last time about the rationing of insulin because the prices of the insulin for people who are diabetics is quadrupled. And they looked at the data and they indicated that the Blacks were the group who were most affected by the rationing of insulin. This then, of course, is particularly bad for those with type 1 diabetes because they have to have insulin. For type 2 diabetes, many of the type 2 diabetics can get by without insulin. So this also is a relatively new crisis that is afflicting us. Any of you aware of people who actually are rationing their insulin?
No.
For me. But anyway, those are two crises that really are problematic in terms of very worrisome for our future. It's bad enough that our schools are experiencing some of the lowest grades ever known to us, but also our mental health issues are becoming alarming. Okay, John, you want to start the slides?
Okay.
There was also an article about insomnia, the fact that we don't treat insomnia very well. And this is something Dr. Georgia Dunstan, who has worked with us a lot and is one who shared with us the concept of soul genomics. And she's a committee chair of Black Women for Positive Change. And as you know, they had a goal of registering 10 million more Black voters. Of course, the issue, of course, is they've done everything they can to suppress Black voters. And so this is particularly important. Talks about the fact that John Lewis was one of the early people. Of course, there were people who were killed because of their support for voting. John is one of the survivors. He was beaten, but he wasn't killed. And so this is a crusade that she's been involved with that hopeful for a major turnout. Now the question is, it'll be days before we know the full results of all of this, all of the voting. But I guess something that was encouraging is that most of the people Trump fought for lost. That's a good sign. But anyway, I hope everybody took the opportunity to vote on Tuesday. In Maryland, we have the first Black governor in the state's history. So
yes.
Okay, well, I think that's a reminder of of the things our predecessors died to get the vote, and so it's great to see that so many blacks did get out to vote. Any comments? Any addition to this? Thoughts?
What sometimes worries me is why do you have to beg some black people to vote? Why? Because I had to convince a lot of my my friends who are blacks to vote, and they refused. They said they don't want to vote. Why is it difficult?
Well, some people think it doesn't matter whether they vote or not. That's one of the reasons. And I think that's probably the excuse they give, that their vote doesn't mean anything, which is a tragedy.
Yes,
Because here, blacks have died so that we can have the right to vote, and then
exactly.
they don't vote. It's a sad commentary.
I used to think the same thing, and then my father told me, he said, if your vote didn't matter, they wouldn't try so hard to stop you from voting.
That says it all. Yeah, yeah, yeah. That's why they try to kill us, to keep us from voting. But it's just like the vaccination. Still have people who don't want to be vaccinated. Okay. It's amazing though that
Yeah.
people are still unregistered.
Yes.
Can't vote without being registered. So, yeah.
I have a family member that back in 1944, my mother's cousin, started the Democratic Party in Georgia. And that's why I guess I feel so sorry about Georgia now, the way they're trying to suppress voters.
They didn't try, they
Yeah,
succeeded.
they are suppressing voters.
Right.
But he risked his life back in 1944 to start the Democratic Party down in Columbus, Georgia. And he's hanging in the state house and everything because of what he did. So I'm almost compelled to go. I get mad at my grandchildren sometimes when they don't always vote, but I get after them. But they vote for the presidential elections, but some of the other ones they don't.
Yeah. Okay. Well, it's another crisis that we've got to overcome. But efforts like your relative are so important. I remember Marion Barry used to talk about how people died just for trying to get people to register to vote in the South. And so it's a sad commentary that some of the young people don't appreciate that these people did not die in vain. Okay. Any other comments? Otherwise, we'll go to the next one. This is something that, fortunately, monkeypox has decreased and is no longer thought to be as much of a problem, although there have been deaths and there have been a number of cases. But the transmission, of course, happens before the symptoms, which is not a surprise. It's just that getting close contact. Remember, we talked about the nurse who got monkeypox from the contact with the skin lesions. And so this is something that the fact still remains that 95% of the patients are bisexual or men who have sex with men. But that also is how HIV started. So fortunately, this is on the wane, and we're not having a lot of cases anymore. So it's
Dr.
good.
Callender, you know, some of these diseases are caught by a virus floating around in the air, and this one, monkeypox, is more about lesions.
That's correct. This is not about air spread. This is about contact. Yeah, sores.
So then that means that you know, the lesions and all is not, you know, what am I trying to say? I'm trying to say that the airborne illnesses are causing them more havoc.
Right, and this is not airborne, so this is less of an issue. Unless you have sex with men, in which case, or unless you have contact with the skin lesions of someone who has this disease. So, okay, you can go to the next one because fortunately this is not, this is waning rather than increasing. Well, this is an interesting article because they have all kinds of medication they're now trying to use to treat severe depression, meaning depression that does not respond to the conventional treatments. And psychedelic drugs have been used for some time for those people for whom the traditional treatments are not successful. And research is still going on into drugs, psychedelic drugs. And since most of the psychedelic drugs are illegal, it becomes an issue. And so research is still going on, whether it's legal or not. And they're still waiting on the studies to demonstrate its value. So while the study's going on, we don't know the answer. There are people who, however, if the treatment that they get is not successful, they get the psychedelic drugs anyway. So anyway, it's good to know that at least it is still research going into it, and if it is found to be a benefit, then they could change the laws. But so far, they have been not found to make a significant difference. But research is still continuing around the world. So, and you see here that earlier research didn't actually show a benefit. Depression, as we know, is very, very common. Anxiety and depression are something that, as we talked about at the beginning of this program, that mental health issues are so common that we don't have enough mental health professionals to actually treat them. And so the mental health illnesses, anxiety, depression, and dementia become a real cause of concern. And I think the fact that depression does lead to suicidal behavior is one of the reasons why we spend so much time addressing depression, especially since we know that the people who are depressed who don't take the medication are the group that often commit suicide.
Dr. Callender, question about the times that we're living in And we are saying that depression is increasing. And I want to know if it's all the different viruses that are out, is that causing depression, or is it the staying home a lot and not being able to do anything?
It's the isolation that seems to be causing the anxiety and depression. Quarantining, the isolation. Yeah, that's the main cause, not the virus. It's our treatment to prevent the virus that is causing havoc.
Carol, come and get me.
uh,
Dr. Callender, I know when I go to my medical doctor, there's a series of questions that they ask you when you log in, and that pertains to your mental and your physical health. At first I was concerned as to why were they asking these types of questions, but it's their way of reaching out to the public. And if they can save one person, then their program has been successful.
yes, and
Or help one person.
yeah, we've talked on this program about the screening and the fact that screening for anxiety is recommended. And so this is one important first step to do that, to screen for anxiety and screen for depression. And if you find that the person identifies that they're depressed, then to get them to go and get mental health professional treatment becomes imperative. Because as you said, the end result is that somebody who has anxiety and is untreated becomes depressed. Depression untreated can become suicidal. And so there, as we talked about in the program recently, people under 65, screening for anxiety and depression becomes very important. And the screening test that you're talking about is something that all physicians probably should use.
Dr. Callender, I noticed the same thing when you go to the doctors. They'll ask you questions and you know the answer, what they're searching for. Does anybody ever, they'll ask you almost bluntly, are you depressed? Are you mentally ill? Do you feel like committing suicide? They're so obvious. Can you remember yesterday? Or, because I asked you the president of the United States, but I guess it's not that obvious to everybody. Or why do they ask the question so obviously?
Because those are the tests. Those are the questions that we feel are important in terms of identifying those people who need help.
Is this a new protocol? I noticed too, yes. My doctor has done yes. that. And I didn't know if it was due to age because I'm a senior, or is it just a new protocol with patients?
It's a new protocol that we've discussed actually.
Yeah.
Because screening for anxiety and depression is an important part of your health. Sometimes people forget that you're not healthy if you aren't mentally well and physically well. Mm-hmm. And it's time we address the mental health aspect of it in the same way that we address the physical aspect of it. And so we're finally waking up and doing something that we perhaps should have done earlier. But now the tests are results are so much that it becomes clear that screening for anxiety and depression for people under 65 is now and is what you're supposed to do. It wasn't that way before. It is that way now. So to me, it's a step in the right direction. Now, the question is, what do you do when you have the screen? Because this is a screening test. That's why I asked those questions. Mm-hmm. Screening test. So if you demonstrate that you are depressed, then the next step is to get mental professional help. And that is where problem is, because we don't have the mental health care providers to address the ever rising number of people who have anxiety and who are depressed. So I think it's a step in the right direction. Yeah.
Good.
Of course, what it does is increase the number of people who need the mental health. And if we don't have enough providers to help that, then what are we doing about the solution to the problem? So we've got to do some of the things that Biden talked about in his State of the Union address, to encourage more people to go into the mental health profession, and also make it so that people can get to doctors who would treat them regardless of their ability to pay. That's not the case now.
I'm wondering whether I'm in the minority. When the pandemic hit, I was happy to be home. All the different projects that I could do without interruption of having to go out. I enjoyed the time. I
Yes,
cleaned the house, and I just enjoyed being home. So
you are in the minority. Right.
yeah, I enjoyed
But
it.
it is what you make of it.
Yeah.
Life is what you make of it. So you can have lemon and make lemonade, or you can be distressed because it's lemon.
No,
So,
I enjoyed
yeah.
it.
So that's wonderful that you've used it, made the most of it. That's what everyone should try to do.
Dr. Callender, it seems like this can also be a vicious cycle, because you might get COVID and have to go to the hospital. Let's say you have a bad case. You can be depressed about that. And so once you get depressed about that, then, you begin to get other problems too.
Yeah. Anxiety is just the beginning of it. And the earlier you address it, the better.
Yeah,
Well,
Dr. Callender.
yes.
Yeah, some people like living a solitude life. They don't like too much crowd or too many friends. In that case, therefore, will you consider isolation, or will you categorize them into people with isolation, and the eventual outcome will be depression or anxiety? People who live solitude life,
People
for the
need
most
people.
part.
I think the simple answer to that is that people need people. And so that getting away from the solitude is a better answer to that question. Solitude is not desirable. People do need people.
Dr. Callender, I didn't so much not need people as that I felt like the world was going so fast sometimes. And I think the pandemic slowed it down. I'm my own best friend, so I don't mind being by myself. I prefer it a lot of times, and I like to selectively engage with other people. But I found that the world was going so fast that I think the pandemic slowed it down, and I think it made it more bearable for people that were maybe felt like they were the little guinea pig on the wheel. So many things to do, so many, you have anxiety because you have so many things to do. But when you step back and you don't have as many things to do, and you can selectively do things, then I think it was better for some people. So I don't think that was unusual.
Well, it is unusual in the sense that what you said is that people still need people, and you still
Yeah, they
need
do.
your circle of friends. What we're talking about is when you have no circle of friends.
Right, right,
Alone. That's different, and that's the enemy. And when you have no friends at all, uh, identifying your circle of friends and staying with your circle of friends, you're still having people needing people.
mhm,
But isolation is when you're by yourself and don't have people.
right,
Having a select group of people, you still have people. So, and most of the studies and analysis of it support the fact that isolation is not healthy.
right,
Yeah, what I meant, was a limited isolation. What I meant, because for instance, my wife, she doesn't like friends. She's happy with being with her kids, her children, or grandchildren, and myself. But other than that, very limited contact with outsiders, and
And
she prefers it that way.
yeah, and that's not isolation either,
Mhm.
because you have a circle of friends.
Yes.
Right.
Dr. Callender, I looked this up one time for those people who are not comfortable with a crowd, in a crowd, and so forth and so on. And that was called avoidant personality disorder.
Mhm. All right. Okay. You ready for the next one?
All right.
But it's this is this is an article that looks at it from a global perspective. This is a father who blames China's COVID policy for his son's death. And, what they're talking about, the COVID policies which we've done away with some time ago. For example, you couldn't go to the hospital to visit your loved one. You couldn't get into the hospital. Well, that was when COVID was at its busiest. Now, when things are better, most places have gotten away from that, and you can have unlimited visiting to a point. But in China, some places, that's not the case. So it's difficult to get to the hospital. And this article talks about all of the difficulties they gave in treating his son, who was affected by gas fumes, and eventually died because nobody would take care of him. They wouldn't even let him get to the hospital because they have such strict lockdown because of COVID. And so many times it's the taking it so far and not ever relaxing that is the problem. So, as you know, the isolation that we talked about was especially prevalent in the hospital where you had difficulty visiting anybody. And so while the COVID was at its highest, uh, you would have a loved one, they wouldn't even let you come and visit the loved one. So the problem is in China, some of this behavior still exists. And this led to what this father thinks is the cause of his son's death. And so you can say it's preventing COVID, but it's really lethal to any other issue. Just thought I'd point out that things are different all over the world. Having a global perspective sometimes help. This is the exact opposite of what we're doing now. Next one, please. Unless there are any comments about it. Now, this is one of the biggest problems that we're having now is pain. And if you ever have pain, like Mr. Tatum had pain, unbearable pain for so long. And one of the things that was happening because of the opioid crisis, getting a doctor to give you pain medicine was a big problem. And almost so that most doctors wouldn't give pain medicine because you wound up being persecuted and prosecuted, especially in people with certain conditions like sickle cell disease and cancer and other entities which are associated with pain. And whether we like it or not, those people with chronic pain problems need to have pain medicine. And this actually got to the point where people who were having pain would go to the doctor. The doctor would give them an aspirin or something and was reluctant to give them any significant pain medicine. And so, as a consequence, the CDC now has come out with a guideline of updated guidelines of how you can be flexible and prescribe opioids for short-term pain in those situations like sickle cell disease and other chronic pain conditions. It's okay to do that. But I encountered a number of situations where doctors were afraid to give pain because they thought they would lose the license. So it's important to have the CDC come up with guidelines to allow people to taper off medication where it's appropriate, and also to recognize those conditions that require you to give patients pain medicine because they have chronic pain problems. So I think this is a very important contribution. The question is, will doctors still be too frightened to give pain medication for those people who actually need it? Have any of you gone to the doctor for pain medicine and been turned down?
No.
That's good.
Yes. I have a pinched nerve in my back, and I asked my primary physician for something for pain, something strong. I've been taking Tylenol. I don't like to take medicine, but I've been taking Tylenol. I asked her for something stronger, but she wouldn't give it to me. She told me to continue taking the Tylenol.
And that's a common phenomenon, and I'm hopeful that that this new guideline will get some of the doctors to be more sensitive to the patients who have chronic pain conditions.
Dr. Callender, I've come into a situation where the doctor would, in other words, instead of prescribing the medicine that you asked for, prescribing something that is a little less strong.
Yes.
I compare two medicines, oxycodone and acetaminophen with codeine.
Well, yeah. Well, you're right. And oxycodone, of course, is one of the drugs they resist giving because it's addicting. And so is the Tylenol with codeine, by the way. It's just that oxycodone is more addictive. And because of the opioid crisis, doctors were reluctant to give oxycodone. And it actually affected the way you practice and whether or not you would be cited by the DC Medical Society. And it's all about the opioid overdoses, believing that treating chronic pain appropriately might result in you getting an addiction, which then may result
Dr. Callender, my mother was in excruciating pain for years. And the doctors, she became depressed because of the pain. And I got her in a program out of Washington Hospital Center. It's a home program where they came to the house to see her, and they were geriologists, and they knew about how to treat older people. And she got on oxycodone, and her she was able to stop taking her medication for depression because her outlook changed, her whole attitude changed once her pain was being managed. And we were afraid of the medicine because we had heard about it. And the doctor told us, he said, she's 90 years old. You know, we're gonna treat her pain, and we're gonna be cautious with it, but you're gonna see a turnaround in your mother. And we did. And one thing that happened is every time I would get the medicine, I had to have a physical prescription. I had to go to the doctor to get it. I had to have I had to show my ID. I had to sign, and they counted the drugs. And
Yeah.
if one was missing, I had to call the doctor to tell them that that one was missing. And I found out later on that they actually did a background check on my brother and I to see if we had troubles with medications or drugs or addiction.
Yes, serious. I'm glad you gave us that. That's a great example of our fear of opioid abuse. And as a consequence, having those people who have chronic pain conditions who can't be properly medicated. And it's you hit the nail on the head. Thank you for giving that good example of how chronic pain can result in depression. Yeah. Well, anyway, I think this is long overdue, and I hope this will make it better. It's nice that the gerontologists were aware of the situation, and I think it's time for Dr. Obisasan to come back again. He was our gerontologist, and I'll invite him back to talk to us about some of these issues. Okay, I put this in there so we could talk about this, because people sometimes are so afraid of addiction that they let patients go in pain without any treatment, which is inhuman. It's inhuman. And of course, can you imagine somebody with sickle cell disease, chronic pain, or any condition like Mr. Tatum was in, and not being able to get anything to get for pain? And just as you mentioned, it in itself, it can cause depression. So, okay, next one, please. Any other comment about this concept? There's so much evidence that highly processed foods link to early death. So much so that you would look at, they talk about hot dog, chips, soda, and ice cream. And all of us eat those things, but yet those processed foods that can, when you do them less than moderation, will result in all kinds of diseases that lead to diabetes, cancer, obesity, and kidney disease. And so there's little question that, as I think Darryl expressed it very well when he mentioned the fact that in the old days people ate and they lived to old ages, but they didn't have all this processed food. And now that we have the processed foods, the incidence of cancer and all these other conditions are increasing. And so that's why the effort to have plant-based diets has become important. And although you see all of these things that we like to get, you have to push back. Of course, those of us who managed to get into the 9th decade sometimes may wonder how we got there. But anyway.
Yeah, I got to make a plug for cooking, because what processed foods have to do with is convenience. They make it so that you either don't have to cook, or if you do cook, it's minimal food preparation. And that's what's killing us. So the most important legacy that we could ever have for our children and grandchildren is that they all cook and cook regularly. Um, even going out to a restaurant, you have to be careful, because a lot of their foods are processed just in terms of they're not prepared fresh. They have freezer deliveries, they freeze it, they thaw it out, and it is processed on their standpoint. You just don't realize because you're just seeing it on a plate. But, as much as you can limit your eating out and accentuate your cooking at home, then the better off we'll be, because that's exactly how the old folks live.
Thank you for teaching us so well, Darryl. You're on the ball. Okay, well spoken.
So you mean homemade chitlins is better than store-bought chitlins?
Leave it to your sister.
Carol, you surprised me. I was going to try to make the same point. Is our, recent ancestors ate stuff like pig's feet, chitlins, hog maw, all that kind of stuff. And whereas I think there were some studies going out to see if that was linked to, these diseases that we have, or whether it was linked to that, especially high blood pressure, because all that food had a lot of salt in it.
So is that a question or a comment?
The question is, does eating those foods like they did, pig tongue, pigtail, all these things, was that harmful?
Well, yeah, it was harmful. You just mentioned all the very worst of the foods that our grandparents ate. There's bad foods, there's good foods. And I don't know why people go to the very worst, but those were the very worst then, and they still are now.
Yeah, this reminds me when I was growing up, even up till when I finished high school, I never saw any restaurant in my life. I never saw pizza or any prepared food. I never saw pizza in my life until I came to the United States in 1972. And my parents, my mother especially, cooks 3 times a day, in the morning, afternoon, and the evening. And we were all happy about that until I moved into the city after my high school. Then I saw a restaurant for the first time in my life. And I came to know about pizza when I came to America. But all in all, those folks, they lived an average life, say 80 something, mid 80s. My parents died in the mid 80s. And but nowadays, people are still living, even despite the processed foods we eat now, people are still living up to 80.
Yeah, but what happens is that there's a segment of people who are dying young.
Yes.
That we forget about.
Yes.
People dying in their 30s, 40s, 50s.
Yes.
Yeah. So, and that's the group that we're talking about that has premature, they call them premature deaths.
Yes. Okay.
Yeah.
Thank you.
It used to be that diabetes was called an old person's disease, and now with processed foods, type 2 diabetics are in their 20s, 30s, and 40s. And that's because of all the added sugars and the fructose that they add to processed foods. Hypertension it's much greater incidence of hypertension because of the added salt in processed foods.
Okay, and they emphasize that fruits and vegetables is the key. Fruits and vegetables. All these other things look great, but fruits and vegetables are the key. Of course, they mentioned the fact about the food deserts, so that in the neighborhood you grew up in may only have McDonald's, Wendy's, and those things, and those are the harbinger of doom.
John, your dad lived to a ripe old age. What did he cook a lot?
My dad,
Yes.
yeah, especially he started really cooking when my mother died. And yeah, he used to cook a lot, but he got in a period of his life where he had bacon every day. for
Really?
breakfast. Yeah. You know, the bacon with the grease and all that every day. So he counterbalanced that, Betty, with a lot of activity and exercise and
Right.
swimming and those kind of things, you know. Walking up the steps of Liberty, you know, he was the only one that could do it so well for his age and all, you know.
That's true.
It was just amazing how, and Dr. Callender knows that he had a steady diet of a glass of alcohol every day. But as we found out that, you know, a glass of alcohol every once in a while is okay.
It's healthy, yeah, right.
Well, I also cooked your father pig feet and pigtails. And he and I would sit down and eat them. But I mostly would make them for my aunt and my mother and him. And I would eat very sparingly. But my doctor told me that my mother had no restrictions in eating. If she got to be 90 years old, she could eat anything she wanted, whenever she wanted. And
Yeah.
that was how we did.
Okay, all right.
And my father was John's father's brother.
Mm.
So they were the swimming team.
Oh, okay.
Oh, really?
That
Oh,
was my father.
Bradford.
Yeah.
oh,
Okay.
yeah. Okay, yeah.
Mhm.
They were quite a team.
Yeah, they were.
Okay, let's go to the next one. This is something that, well, you know, this is this goes back to something else that Darryl talked about, which is, you know, when you quit anything, you got to have something to follow up on it, you know, because I have a lot of colleagues who quit medicine, but they didn't have a backup situation, and as a consequence, they were unhappy for much of the rest of their lives. So that it's okay to quit one thing as long as you have a plan to do something else. And I thought that Darryl expressed it well when he talked about how he left his main job and became an entertainer and did something else. So and I think if you are going to retire and have nothing to do, it's expected that you're going to have a shorter life than if you retired and had another something else to do, whatever it is. But to sit back and do nothing when you've done something all your life is not healthy. Any comments? Because many of us on this call are at the age of retirement and are doing many things, so that retirement doesn't mean dying. It just means you change from one phase of your life to another phase of your life. And if you love helping people, then as long as you're physically able, you should try to continue to do that as long as you're able. Any comments about that? Because we're in an age group that it's easy to say, okay, I'm 65, it's time to retire. Retire from what to do what? And that's the question.
Dr. Callender, I think the worst thing about retirement is having friends and family and with their advice, because I like to stay busy, but they want me to sit down. They say you're too busy. You got to slow down and everything. And I'm feeling fine as long as I'm moving around. If you see an elderly person on the bus, they want you to sit down rather than standing. And you know, sitting can harm you more than just standing. In fact, standing is better for you. They don't want you to lift a finger. I know when my father-in-law became ill and everything, the family came around him. Don't go up and down the steps. You're walking too much. He had to sneak out the house to walk around the block because they wanted him just to stay still, take it easy, relax. And that's one of our worst enemies, is to relax. Don't do any housework. You're working too hard and all of that. That's what keeps you healthy, is working. But they want you to slow down and die.
Well spoken, well spoken.
Yes.
Well, I got a comment. They say, if you love what you do, you never work a day in your life. And do what you love what you do. But even more important than that, you have to enjoy your life every day. So a life well lived is one where you could say, yesterday I had a good time. Today, so far, I'm having a good time, and I plan to have a good time the rest of the day. You know, if you really enjoy your life, that's a life well lived.
Yeah.
Well spoken.
Okay.
Any other gems?
Yeah.
A life with purpose, a life with meaning.
Absolutely.
Mhm.
I took an early out from my government job. I retired at 48, and
Wow.
I and after I had 30 years, but I didn't have the age. But soon as I retired, I became a trustee at my church, and that's a whole nother job. So you just keep going. Yeah.
Yeah, I agree. I retired as a teacher, and I used to say I taught everything from can't use tissue to could use tissue. And so I taught early childhood all the way through college and adults as well. And when I retired June. And I retired in June because of the fact that that's when teachers go on vacation. So I wanted to be on vacation the rest of my life. So I retired in June, but then I started doing things I love. I've always loved teaching. I've always loved working with people. I've always loved sharing information. And before I became a wellness coach, I was already sharing things that my grandfather and my parents taught me. And I worked 20 years in wellness, in health and wellness, and then 20 years as a teacher. And so I just combine all my talents together, and I now do everything in one thing. I teach nutritional class, I teach wellness, and the list goes on. And I enjoy it, but I enjoy it at my pace.
Wow, this is a very good library.
Dr. Callender, what about a person who retires and, like this article here, regrets it? And not necessarily regret, but decide to go back to it. You know, decides to go back to it. I think that's okay, isn't it?
I think it's desirable. I think it's desirable because, you know, life is full of learning from your mistakes. And so he made a mistake in retiring and he want to go back to do it. Good for him or her. Yeah.
Yeah, but this guy right here in this article, he said, I think he said he's not gonna go back to it.
Yeah, I know, but I think to each his own. I think you need to go back to doing something that's going to keep him alive. And I think Elizabeth and Darryl expressed it well, as did the rest of you. That you've got to be. There's a reason for living, and so you gotta. The worst thing you can do is do nothing, as Carol said. So.
This is Vivian. I would like to have an input. I retired about 11 years ago. I was a human resource specialist. And when I first started, I didn't know exactly in what area I wanted to work, but I love working with people. And, you know, I would set up training classes. I would go out and I was teaching. I've retired. Since I retired, I'm on dialysis. And what I do now, and, you know, well, first, I started working at Operation Hope. I was going there because I enjoyed helping people, the returning offenders, showing them how to look for jobs, that you don't have to do a complete resume, how to check and so forth. I love the work. And it made me feel good when I would have someone come back and say, guess what? I have 2 kids. I found a job. I love doing it, but my thing is this. Now what I do, I talk to a lot of friends and families and different people I don't even know about, you know, dialysis process and how I survived it, and getting a transplant, and how it's still a process. And they even asked me to speak at the Georgetown Hospital, and I didn't expect that many people to be there. You're telling about transferring from dialysis, but now I'm listening to this. It's interesting to me. I was trying to decide what I'm going to do. I'm doing it, but I'm doing it from home or just talking to different people. Anybody have any suggestions for me?
Sounds wonderful. And because I think you're sharing your life with others. Any other thoughts? Some of these people have been on dialysis, and they can give you their opinions from experience.
Yeah, because I traveled while I was on dialysis. My daughter and I was in Memphis. I went to different places, and I would go, and when they were setting dialysis up and I was taking apart and looking, it was a great process. They treated me like a superstar. So you can still travel. You can still enjoy your life and take care of yourself. It's a process. I think a lot of it has to do with the mind and so forth. But for me, I would leave and go home, rest a while, go to prayer breakfast, go out with my mom, go out with the family. And I love talking to people. But I was listening to the ladies that are wellness specialists. I'm listening to John as he shared, and I was saying, wow, one is a way that I can do the same thing with what I have learned.
What a wonderful story that you gave us. Any other comments? Anybody else want to express themselves?
Yes, I retired about 6 years ago after working for almost 35 years. You know, I taught at Howard, worked at NIH, and then taught in the DC public school. And most of the time I was doing these jobs at one time, or at least 2 jobs or 3 jobs at the same time for almost 35 years. So when I retired, it was time for me to rest. But that resting is not just sitting at home doing nothing. I found, you know, my passion was tennis. So that is what I love. Tennis, playing tennis.
Really?
Yeah, I play tennis almost every morning. Except, yeah, some of your students are with me. Some of your students are in my team. Devonte, you know, he knows you very well. So we are about 50 or so in our group. We play every morning. Our team is called Early Morning Tennis Team. We play from 6:30 to about 12 o'clock or 1 o'clock in the afternoon.
Really?
Yes. Some of the time, sometimes when I join this group, this therapy group, I joined them from the tennis court. Yeah. So you know, retirement, it's not just like you are dead. It's, you find something, to engage yourself with. Some of my friends who retired, my colleagues, they have nothing to do. They sit at home day in and day out, watching TV, drinking. If you see, they have put in, they have put on twice their weight now. So in the tennis court, people wonder why I'm still active, because I love what I'm doing, So to just summarize, retirement is not a death sentence. It's being able to do what you like, what you enjoy doing. Some people go back to work because to make more money. That's, to me, that's not the primary reason, for retirement. You retire and then you go and look another job for more. You're just chasing the money all the time. It's just relax and do whatever whatever pleases you. Okay, that's all I have.
That's enough.
Yes.
Thank you.
Yeah,
Thank you for sharing. Thank you for
Yeah,
sharing.
I have a couple of comments based on what Doc just said. Yeah, I had a co-worker right across the hall from me that worked in the DC public schools for ages and ages. And he waited. He said he was going to wait to retire. And sadly, he waited till he was 62 to retire. And by the end of that year, he had passed away.
Oh.
And he was trying to save the money, to do stuff, and he couldn't do it. Well, I retired when I was 65. So that was like 11 years ago, almost. And well, I not 65, but I just turned 73 on Sunday. And I figured that based on what was going on in the school system, I was a victim of ageism. Because at my salary, you could hire 3 brand new teachers at my salary. So I was so upset with those people. I was glad to get out of there. In fact, I didn't retire on time, and they wanted to fine me $1,500 because I didn't retire at the correct time of year. I had to write the superintendent to get the money back, which they did eventually. But I have been busy. I'm able to now swim and dive. I'm on a dive trip right now. And COVID really kind of messed up all my big plans for travel. I really want to travel. I want to go to Africa. That's on my bucket list. I want to go to Nigeria.
Oh, great.
To see my family, my original family.
Okay.
My genetic profile says that I've got a lot of Nigerian
blood. Okay.
Yeah, so I have to do that. But that's bucket list. And right now I'm in Curacao, which is one of the ABC islands just north of Venezuela.
Okay.
50 miles north of Venezuela. And this is my second trip here for scuba diving. And this is one thing that I really wanted to do in my life, which was to be underwater and see the world. I mean, it's a much bigger world underwater than we have above water on land. And it is fantastic. But I've also seen the effects of global warming up close. So I'm very involved with growing coral, and also I don't know if you guys saw the special on Netflix called Descendants. You really need to look at that. That's the last slave ship that came over after slavery was banned in the United States.
Mm.
And some of my friends helped to find that ship. They tried to burn it down in Georgia. And no, Mobile, that's Alabama, right?
Mhm.
Yeah.
Yeah.
Yeah. So, but anyway, I stay active. Like I said, I swim 3 times a week. I used to walk like 6 and 7 miles a day, but I like swimming better. And I play music as well. Not as good as Darryl, but I still stay very, very active. So, you know, retirement for me is not ending, it's a beginning.
Very good. Okay. Wow. This was wonderful. Let's go to the next one because I think, gee, this was a class. A class. Yeah. Okay, next one, John. This is a class from the experts. We did this, yeah. Now this is a this is an article that may be problematic for many. To the fact is that we do have a shorter lifespan than people who are in developed countries, and this is because of the fact that they point out here, we don't have universal health coverage. We don't have revenues on social services. And we have many administrative barriers. Yeah, so that kind of answers the question, but it goes on to talk about the fact that we spend more on healthcare than any other nation, and yet we don't get to the top 5. We have shorter lifespans, and this is one of the few developed countries that spend so much on healthcare, but still doesn't live that long. Look at we have people die younger than those in other middle and high income countries, and our life expectancy is 78.8, which is significantly lower than these countries you see here. They're in the 80s. Not to speak about our maternal mortality rates, which are horrible. So that the question is not why, but because we know why, but these are the diseases that are killing us. And what are the circumstances? Well, we've mentioned them already, but I'll repeat them again. And I think that they call it fragmentation of healthcare, although I think most of it is related to the fact that we don't have universal health insurance coverage. The only disease for which we have universal coverage is end-stage renal disease. All other diseases, there are many financial barriers. And the community, I've learned, of course, is the most efficient health agent that we have, but we don't take advantage of the community base like other countries do, and that's something we need to do. And healthcare does not seem to be the priority it should be. Now, of course, we have Medicare for those who are over 65, but those under 65, not so. And then quality versus quantity is healthy lifestyles, diet, which we've talked about ad nauseam, and cognitive and physical activity, all of that. Yeah. All those are part of it. The one thing that we really haven't talked about, even though we talk about healthy lifestyles, is the value of meditation. And I think that's one of the things that we don't talk much about our spirituality. And our spirituality oftentimes can be the most important part of your health, because it leads to mental as well as physical health. And we spend too little time on preventive health care. And that's where we fall down. We spend so much time on treating disease that we don't spend enough time on preventing disease.
I've got a comment on American lifespan, and that has to do with American food. American food is the cheapest food in the world. We spend less percentage of income on food than any other place in the world, and that's primarily because a lot of our all of our just about all conventional meats, unless you're getting organic meats, your chickens, your poultry, your beef, your pork, they're all fed with primarily corn and soy. Corn because they get government price supports and it lowers the price of corn, so it's cheaper to feed your cow corn than it is grass, and grass grows everywhere. Well, that's not their natural diet. It makes poultry, beef, and pork. It makes them sick. So to get them to market, you got to pump them up with antibiotics to keep them well to get them to market. And then they pump them up in America, not the rest of the world, with growth hormones. And and the grain that they're feeding them is full of pesticides. So now that's all in American food and American meats. It's the worst meat in the world, and that impacts your lifespan. And and then we're more preservative heavy for our conventional fruits and vegetables in America. So it's cheap, but it's terrible food in America. You go other places in the world, and the food tastes so much better because we haven't killed our food like we do it in America. And the second thing, you go around the world and you see that people are more active. They walk more. They walk more to get to the grocery, to get to wherever they're, to the cleaners, to the bakery. But they're walking. In America, we don't walk. We drive. And so we're the most sedentary people in the world. And, it shows up in our weight. You go around the world, you can always spot the Americans. They're the fat ones.
Okay.
Yeah.
I think those are important points to take into consideration.
Yeah.
Also, we aren't as patient-centered as we should be, because our patients should be more responsible for their health than they are. And I think that's something that we as health professionals should require.
Yes. Yes. According to the last speaker, the points he made are very, very, very genuine. But one thing, these American foods that are produced, in mass quantity, prevents hunger in America than compared to the third world countries who do not have preservatives or hormones to inject their meat, and so American produce food en masse to feed the population and even feed some parts of the world, Once in the developing or underdeveloped countries, they lack that facility to produce mass quantity of food and preserve those food for their population.
Okay, let's go to the next one. We discussed that. It's almost 10:30. And I think that all of the points are well taken. So that's one thing on this program. We have a diversity of opinions, and all of them are appropriate. Now, I put this in here because the epigenetics, I'm not sure people really know what epigenetics is. And even in this article, they don't really explain what it is. But I'll tell you what makes epigenetics important. Genetics says that the gene pool determines whether you live or die and whether you have all these kinds of diseases. What epigenetics is the social factors and external factors that affect the gene. So the social determinants of health. These are factors that affect the gene pool. And it may affect them in this generation or the next. So that your lifestyle and how you live, the social environment affects the gene pool. And that's what epigenetics is all about, to point out that we used to say the genes tell the whole story. Yeah, well, they tell the story, but for example, when Georgia Dunster talked about soul genomics, what she's talking about is that there's so many factors that affect the gene, and the genes then affect everything else. But the social determinants of health affect the genes today as well as tomorrow. And so it's not just what's inside, but it's also what's outside. So your environment, social as well as external, actually affect your genes. And that, so when we talk about epigenetics, that's what we're talking about, how those factors that are not inside your body affect you and make you more likely to have diseases like cancer and other things. So, this then is something that is often difficult for people to understand. I remember when I was about 30 years ago, somebody made a comment that the social determinants of health affect the gene pool as much as anything else. And most people thought that they were off out of their minds. But now we know that they're exactly right. And that's what epigenetics is all about, the fact that factors that are outside impact the genes, and also impact what you spread it to the next generation.
Yeah, comment. You know, this can be further illustrated by twin studies. This question of epigenetics. We see twins, identical twins. After birth, they are separated far away. And you will see their behavior later on in life are totally different, you know. So gene environment interactions, you know, can greatly affect the gene pool in any community or in any society.
Well, it's right up your alley, huh, Dr. Atto?
Thank you.
Dr. Atto, did you know that Dr. Callender is an identical twin?
Oh, I didn't know that.
Yeah.
So he became a medical doctor, and his brother, identical twin brother, became a judge.
And my twin brother can't stand the sight of blood.
Oh my God.
And I'm a surgeon.
Oh my goodness, yes.
And you don't like the law.
Yes.
No, I can't. I don't know how he could stand all those law books.
That's exactly why I did not become a doctor, because I don't like blood.
Listen to a man who gets given 100 units of blood.
Yes.
How about that?
Yes.
You know what? I might have some of his blood.
Yes.
You might.
Are you O positive?
I don't know. I have to ask Dr. Callender because I don't know.
I'll never tell. Okay. Any other questions about epigenetics? Because for many, they didn't really understand. And this article doesn't really help you understand it either. So I thought I'd just take an opportunity to let you know about epigenetics, because everything you do impacts the genes.
Yes.
Okay, you can go to the next one unless there's any questions about this one. If you have high blood pressure, avoid these foods. Well, limit your cheese and choose the right ones. How about that? Some cheeses contain more sodium than seawater. Feta, halloumi, Roquefort. I don't know what those things are anyway. I guess you have to be a cheese expert to know some of those things. Any of you guys know about all these different cheeses?
Nope.
Yeah,
Darryl, you know much about these cheeses?
I put cheese on everything. I put cheese on grits.
More
eggs.
soda equals higher blood pressure.
Okay.
Yeah, all you need to know that cheese contains hidden sodium.
Okay.
Cheese is preserved a long time. So when things are preserved that long, it has a high content of sodium.
So when you go to a fast food restaurant like Olive Garden, which you shouldn't go to in the first place, don't let them add the extra cheese.
Save the extra cheese for me.
Okay.
Even that cheese that in that bottle that they squeeze, that they turn, cheese period.
Everything is good.
That's what makes it better, cheese.
Yeah. Exactly right.
Hey, I have
remember
noticed it a lot on the. I'm sorry, this is Sylvia. I have noticed it a lot on the keto diet. Cheese, and more cheese.
Yeah.
So I'm not sure, where we're going with this cheese issue, because, every time you see a recipe and somebody cooking something on a keto diet, it's a bunch of cheese going on that.
Yeah.
plate.
Yeah, that had its merits, but it does have sodium. So.
Yeah, well, not all diets are for us. African Americans are about 80% lactose intolerant, and that's all dairy products. Cheese is a dairy product.
My father was lactose intolerant, and I'm not. Neither was my son or my mom. Neither of my sons or my mom are lactose intolerant.
Right. There's a range of lactose intolerance, all the way from stomach cramps to just mild gas. But don't think that just because you don't have any major symptoms that you're not lactose intolerant, because if you're black, you probably are.
Well, keep going down. It's interesting. They talk about delicatessen meats. I was really surprised at how the benefits of coffee. That surprised me. And there's still studies that show that caffeine are very beneficial.
Well, on the subject of deli meat, I saw a documentary that says eating deli meat is like taking pieces of a cigarette, pouring olive oil, and frying it.
Okay, let's go on down the line on this one. This is the one that sugar is worse than salt. There's been a battle about which is worse. And some people say sugar is worse, some say salt is worse. But nobody says either of them is great. Whether we're sugar addicts or not. Those are two. And there's so much data that shows the negative impact of sugar on health.
One thing that I've learned, that I've encouraged, when you pick up something and it says no sugar added, please turn to the back of the label and you will see that there's sugar.
Right. That just means no sugar added, but that does not mean that there's not sugar in it.
Right.
That's the problem. Right. Good point. Good point. Okay. Anybody love pickles?
I love pickles.
Anybody love salt?
Everybody loves sugar.
Yeah. Good point. Good point.
Yeah, because these pickles, especially the sour pickles and the dill pickles, they have so much salt in them.
Yeah. Yeah. Well, it's interesting that the role nutrition plays for your health.
I have one question about this sugar and the salt. What about the apples we eat? They are filled up with sugar, fruit sugar. Is that bad?
Which is okay.
Okay.
Yeah, you're right. The fruits
Yes.
do have sugar.
Yeah. When you eat whole fruits,
Yes.
it's the fruit sugar along with fiber, and
Yes.
fiber regulates the absorption of that it gets processed into glucose, but
Okay.
it regulates the absorption, and you do fine with it. So you do fine with fruit sugars.
And then with the salt, in the long time ago, in the villages in Africa, where I lived, we preserved fish and meat with salt,
Right.
and nothing went wrong with us.
Yeah. Well, that of course was the way things were preserved.
Yeah.
Then, and everything that was preserved was salt.
Yeah.
Right. Well, I guess it may be a function of epigenomics, but they say that African Americans are more salt sensitive because of the transatlantic slave passage and that's still in our genes, that we're more salt sensitive. So it may affect us as a group in America more than it does Africans.
Okay.
Yeah. That's exactly right.
Okay.
Canned tomato products, again, salt is the basis of that. But it's actually almost unavoidable. How you cook red meat matters.
Dr. Callender, I want to ask you this question again. I know I asked you before, but there is a recommended amount of salt that we're supposed to have in our body.
Right. So I think, for example, I think 5 grams of salt is probably about the upper limit. People on a salt-free diet would be 2 grams of sodium, but above 5 grams is probably above which you don't want to go with salt.
Thank you.
5 grams per what?
Per day.
Yeah. 5 grams per day. Yeah. Okay. It's interesting how I think Darryl mentioned this before. How they talk about sneaking sugar, but they don't talk about the sodium salt that they have in other things like ketchup and all these other sauces. And they call them sneaky salt sauces.
If you remember McDonald's French fries, some of the most delicious fries you can get, right?
Yeah.
And they used to just dump the salt on it.
They used to
dump the salt. And now they've cut back quite a bit on the salt that they put on them, but they still taste good.
Yeah.
Yeah, hot sauce, tremendous amount of salt in hot sauce. You may as well be mainlining it.
Yeah.
But actually, for me, French fries are only a vehicle for ketchup.
Which is more sodium, right?
Wish. I'm gonna have to find some low sodium.
That's interesting to talk about dark chocolate. Okay, Joyce, take care. It's 10:30, so we're getting close to the end. Canned beans. Mm. Mm. Sauerkraut.
Mm.
900 milligrams of sodium. Yeah.
I'm just gonna drink water for the rest of my life.
Good idea.
That's interesting, this BPA, bisphenol A, found in plastics and can linings that affect everything we eat. Good. Donuts just don't, huh? What doesn't affect you?
Like Betty said, water.
Why you shouldn't eat white rice? Yeah.
Just so long as the water is not contaminated.
I'd get ready to say it's according to where it comes from.
You come from Michigan, you better watch out.
Peanut butter, sauce, sugar as well. Fried meals. Well known.
Oh, this is the
Familiar
one.
with ramen noodles, are you?
Oh my goodness, I used to love these things.
That's
almost 2 grams of salt there. Wow. Wow.
Just one of those is, I guess, 20% or that 40% of your total amount.
Yeah, that's right.
Oh my goodness, just one of them.
Yeah. That's amazing how we've survived this long. What's the next one? What's the next one?
Let's see. Oh, this was a long one here.
Yeah, we
might be out.
This is the last one? Okay.
I think we don't have any more, is what I think.
Good, okay. Because it's 10:30 already. And we've covered a lot of areas. Oh, the blood pressure medicine one. Yeah. This is the article that talks about whether you take your blood pressure in the morning or in the afternoon. Actually, there was data before that said it mattered. This article says that it doesn't matter whether you take morning or afternoon. Actually, some people take blood pressure medicine in the morning and afternoon. But there was a lot of debate over whether it mattered. And this study shows that it didn't matter whether you took your medicine in the morning or at night. But for those who take it twice a day, it's irrelevant because you take one in the morning and one at night.
My doctor.
What's most important is that you take your blood pressure and you know that your blood pressure is well controlled. So there was a lot of evidence that people were on high blood pressure medicine but were not checking their blood pressure to find out if the blood pressure medicine was actually working. And so everybody should have a blood pressure apparatus that you can check at home to make sure that your blood pressure is staying under 130 systolic.
My doctor just recently put me on a program where I have to take my blood pressure every day because it fluctuates when I go to the office. And in the training for how to use the machine, I asked what time of day or when should I take my pressure. And she asked me about medications that I took. And I told her I wasn't on any medication. I just took some supplements, but I was not on any prescribed medications. And the lady said that it didn't matter what time of day I took my pressure.
Right. I would argue that if you're going to take it, it's a good idea if you're going to take it twice a day, once in the morning and once in the afternoon.
Oh,
okay. If you are really concerned, because the question is, in the morning, what is it? What is it at the end of the day?
Yes, and some of the high blood pressure medicine is time release. So you have to know your medicine and you have to talk with your doctor.
Right.
I'm not on any medication.
That's what's nice about it. Yeah.
He's testing me to see whether she needs to put me on medication.
Right. Yeah, that's why I think once in the morning, once in the afternoon is a good way to do it.
Okay.
Yeah, white coat hypertension is something that does exist, where your blood pressure only goes up when you go to the doctor's office. And that's why the pressure that really matters is the pressure that you take at home, where I think you should take it in the morning and the afternoon. That would be my advice. Okay, so this probably is the last one, right?
I believe so. I will double check.
Well, we need to, well, the flu season is here. I hope everybody's gotten their flu vaccine as well as their COVID vaccine. We still don't have the RSV vaccine. So, so when you go to crowded areas, you're probably better off wearing a mask. Although you'll be everywhere I go now, I'm almost the Lone Ranger with a mask because nobody wears masks anymore. So, but this is the season. So,
Yeah, this is the last article, Doctor.
okay.
Dr. Callender, I found out nobody's wearing masks except for in church. Now all the churches are still wearing them, but I don't see anybody else.
Yeah, I think you're right. I've noticed that.
I have to wear one when I see my doctor at Howard.
Oh yeah, if you go to the hospital, you have to wear it. Yeah.
A hospital and church.
Yeah.
I wear mine going to the grocery store too.
I do
but
too.
You don't see anybody else.
I don't care.
I'm a Lone Ranger. I'm a Lone Ranger.
That don't bother me.
Me either.
Yeah.
Yeah. Well, we've had a nice time, had a nice audience.